Fellow dentists living abroad. My name is Seo Jung Wook, and I own a small clinic in Korea. Nice to meet you. Dio is offering several lectures these days. It seems that I was asked to give a lecture on how to digitalize dental clinics rather than on specific surgeries.
이 디지털을 치과에 들어오게 해서 잘 사용할 수 있을까? 그런 취지로 이제 저에게 강의를 맡기신 것 같아서 제
I
강의는
hope
좀
my lecture would
간단하게
help motivate the digitalization of the clinic.
생각보다는 어떻게 하면 이번 기회에 디지털을 우리 치과에 한번 접목해 볼까라는 생각을 동기부여 그런 거를 할 수 있는 한 번이라도 그런 생각을 할 수만 있으면 좀 그래서 도움이 됐으면 좋겠습니다. 일단
There is a
저는
word, computer illiterate.
한국 말이긴 한데 컴맹이라는 말이 있습니다.
I'm
저는
good at using digital
기본적으로 이
equipment now,
디지털을
but when I
지금
first started 3 years ago, I was a computer illiterate who couldn't even handle basic computer software.
컴퓨터 소프트웨어도 다루지 못하는 컴맹이었는데
But as I was browsing through the trend of the dental industry, I came to have a vague notion that digital would soon become the mainstream. At that time, Dio visited my clinic and explained about the guide surgery, where implants are placed digitally. So at first, I listened to their explanation of implants. As I was listening to their explanation on scanners, I thought, I should try to digitalize my clinic so everything can be done digitally. I don't know why I came to think so. So, the first thing I would like to say to those listening to this lecture is that the mindset and the determination to do everything in the clinic digitally is most important. As you push forward with your will, you will experience trials and errors. You will need money and equipment, and learn new things. And a computer illiterate like I have to handle a computer. There are many inconveniences and annoyances along the way. But if you have the will, you can overcome them one by one. And eventually, like the title, Happy Dental Life with Digital, you can live a happy dentist life with digitalization. So I would like to recommend this with confidence. I do not recommend using analog and digital methods at the same time. You should somehow try to use the digital method at all costs to stay in this direction. This is the most important thing. If you don't, after a while, when it's difficult and uncomfortable, you are prone to go back to your regular analog practice. To go over that, operating the clinic digitally is most important. Now, let's see why we can have a happy dental life with digitalization. The first is the scanner. You can jump right into a guide surgery, but it would be better to start with a scanner for general prostheses, crowns, inlays, etc. If you give it a try, you'll see how many advantages it has and why it's comfortable. Few dentists in Korea take impressions, but not many. Since I decided to digitalize everything from the beginning, I tried to do everything myself and acquire it myself. So if you see here, some of you may know this is an oral scanner. I explained to the patients that while we used to make stone models, we now make a model with a computer using this oral scanner. That's what I say to the patients.
치과 의사분들
But it's
입장에서는
good for dentists as
제일
well for
좋은 게
many
뭐냐면
reasons.
일단은
Once something
이
is scanned,
스캐너는
the scanned
한 번
image is
스캔을
retained.
하면 이게 그대로 유지가 되기 때문에 이 상태에서 만약에
So if we have to make an
이제
impression at this point,
오퍼레이션을 한다고 생각했을 때는
when
요거를
the stone
스캔을
model doesn't
떴는데
come out
잘
well,
안
we have
나오면
to make
다시
another
껴야
one.
되잖아요.
But
근데
with this
이
scanner, you
스캐너에서는
can
안 나온
slightly
부분을
erase the
살짝
part that does
지우고
not come out well
거기만 다시
and scan
스캔을
that part
해줍니다.
again.
그다음에 여기
And there
여러
are
가지
various
기능들이
functions.
있는데 요 마진
For
부분은
example, this
예를
margin
들어서
allows you to scan with high
요
magnification
모델을
for high
붙여가지고 좀 더
accuracy.
정확하게 할 수 있고요. 그다음에
You can edit
그
as many times as you
얼마든지
want
이제
after
수정도
that.
가능할 뿐더러 제가 요 화면을
I'm showing this
보여드리는 이유는 우리가
screen
이걸 하면
because this was
가장
the one thing I was most
신기하고
excited
좋았던 게
about.
뭐냐면 우리가
As
나중에
we set up
세팅을 할
afterward,
때 교합
we
조정
have to
좀
spend
하시는
considerable
케이스가
time
많은데
making
지금
occlusal
이
adjustments.
보시면 여기
This case here,
23번
it is a
부분
5-unit
부분까지
bridge from number 23 to number 27.
입니다. 근데
But
여기는
here,
지금
as you can
보시다시피
see,
교합이 다
there's a
써
gap
있어요.
in the occlusion.
근데 이것을
But if you have to
인상대로
acquire
인상을
an
채색을
impression
한다고
here with
생각했을
impression
때는
materials, you have to
정말 이
take the
전체
entire
풀
full
안식을 다
arch,
써야
and it
되고
is very
아이트
difficult to acquire
채색도
bites.
굉장히 어렵습니다.
As you may have
설계가 잘한다
experienced,
하더라도
even if you are good at it,
어렵지만
when adjusting the occlusion,
나중에 이거
of course,
세팅을
there are
할
not
때
many
물론
antagonist
여기는
teeth here,
장치가
but assuming that there are
많지는 장치가
antagonist
있다는
teeth,
가정했을
it
때
takes a long
다섯
time to get an
개짜리가
occlusion of
필요한데
5 teeth.
인상
If you have
채색을
tried to
해가지고
adjust the
만드는
occlusion by
교합
taking an
조정이
impression,
생각보다 시간이
you will
오래
agree that
걸린다는
this
걸 다
adjustment takes
공감하실
more
거예요.
time than expected.
그런데 이 스캐너의
However,
제가
one of
써본
the
가장
biggest
좋은 것 중에
advantages of
하나가
using this scanner
이렇게
is that if a
환자가
scan is made
바이트를
while the
한
patient bites
상태에서
down like
여기를
this,
스캔을
an
하면
occlusion is
자동으로
adjusted
교합이
automatically.
눌려요. 이쪽하고
Even if there are not many teeth
반대쪽도.
on this side and the other side,
이렇게 뭐
an
치아가 많지
occlusion is
않아도
adjusted with the
이
scanned
스캔으로
gums,
해가지고
and the
교합이
occlusion
눌러지거든요.
adjustment time is reduced significantly.
일단은 교합 조정 시간이 어마어마하게 줍니다. 이런 케이스가
In this case,
제가
I think the time is
생각하기에는
reduced to
거의
1/5, and for single crowns, mostly they're done in 10 minutes.
10분 안에 끝나는 것 같아요. 이제 이
Now, if
데이터가
you think about why
왜 이게
this
더
data is
정확한
more
가정을
accurate,
생각을 해보면
there's an error
인상은
of the impression
아무래도
material
인상대
itself.
자체의 오차, 거기에
Many
손을
processes
대고
may cause
여러 가지
errors,
오차가
such as
생기는
pouring
작업
stone
과정이
materials.
있지만 이
But with the
스캐너는
scanner,
한번
I think it's
데이터가
because
그대로
once the data
바로
goes in, the design is done in software right away.
제가 볼 때는 그것 때문에 그런 것 같아요. 일단
The scanner
효율성은
improved as the
이제 계속
precision has
업그레이드가
constantly been
되면서
upgraded.
스캐너가 좋아져가지고 저는 지금은
I'm at a stage where I no longer worry about whether it would fit,
이게
whether it's
맞을까 안
single or
맞을까를
5-piece.
고민하는 시기는 지났습니다. 그래서 처음에는 어떻게 했냐면 일단은 이제 스캐너를
You would feel
사셔서
nervous when you first buy a scanner and try it. What I did first, I started with a single, and I made a scan and a model at the same time. And I sent them both to make 2 prostheses. Because I was more familiar with the model, and I took 2 prostheses, one which made with a model, and another one made with a scan, and I started fitting the 2 on the patient. After trying it 3 to 4 times, there was nothing to worry about. It fits so well, and it's much more accurate than the one made with an impression model. But, of course, you will face trial and error. You wouldn't be good at scanning immediately, because it takes practice. But if you, dentists, do it yourselves, it wouldn't take that long. This will make you happy because taking an impression itself takes about 5 minutes to make a regular prosthesis, for the impression to harden while biting. And if you make a mistake, the patient may bleed, and you may have to take the impression again. But here, you only have to scan once. Edit only the necessary part, erase, and rescan. The scanning process is very short compared to the impression-making process. In addition to making an impression, during prepping, when the vertical dimension is too low, we usually use wax to take a bite. You'll be able to check the exact point when you rotate it after taking the impression. So just slightly prep that part only, scan again, erase, and scan again. Features like these are very convenient when you use it. So compared to making impressions, making a prep and scanning on the first day is much easier.
그다음에
Then,
세팅할
as you will
때도 아까
see, it's very
좀 별도로
precise when setting the
세팅하셨고
prosthesis as well.
기본적으로 이제 해보시면 자꾸 시행착오를 거치겠지만 해보시면 나중에는 정말 이게 너무 정밀해서 이렇게 5개짜리 뭐
So I'm doing all
7개짜리
the
다
bridges,
보내지고
crowns, and
웬만한
inlays in my
모든
clinic
임플란트 크라운
100% digitally,
인레이를
whether it's
100%
5 or
디지털로
7.
하는데 예전에
And it
비하면
seems that
세팅
the adjustment
시간이
time is less than
이번에는 안 걸린
1/5
것
than when I
같아요.
use the stone impression
그리고
model.
자꾸 이렇게 디자인을 이제
And I
뭐
don't
제가 직접
design the guide
디자인하진
myself,
않지만 저희
but
그
after our lab
랩에서도
technician make designs many
자꾸 하시다
times,
보니까
her skills
점점
got better and
그게
better.
실력이 늘어가지고 어떤 경우는
In some
환자가
cases, the
옛날에
adjustment
레이저
time is
하면서
so
뭐
short
이렇게
that
얘기하시는
some
분들도
patients
있을
say that
정도로
it is more comfortable than the original
세팅
tooth.
시간이 너무 짧고 그다음에
And
기본적으로
especially in the case
안
of a
맞아가지고
long
재생을 한 적이
bridge,
없는 것
I
같아요.
have never
거의
had to make another
실질적으로.
one just because
그래서
it didn't fit.
그러니까 뭐
So,
해피하다는 게
to
치과
be happy as a
의사로서
dentist
의사
means that after
프랩해가지고 코
prepping a
잘
patient,
풀고 스킨 잘
impression is
빼고
taken
컴퍼니 잘
well,
끝나고
scan is taken
세팅할 때
well, everything
저도
is done
스트레스
at
없이
once,
조합면 다
the
날아가지
occlusal
않고
surface does
적절하게
not
잘
disappear
맞아서
when setting,
간단하게
everything
세팅하고
is fitted
환자분도
properly and
만족하고
seated easily,
그런
and the
것들이
patient is satisfied.
일반 보철에서는
Compared to the past, when I
훨씬
made a model
예전에
by
제가
acquiring impressions,
폰 떴을 때
everything became
치아
easier.
보면 인상 체득을 했을 때랑 비교하면 훨씬 수월한 것 같습니다. 그리고 이거는 뭐 한국에서만
And it may
해당되는
apply to
얘기인지
the cases in
모르겠지만
Korea, but as I did all
제가
the
직접
work
하다
myself,
보니까
I tend to rely less on my
그거에 대한
staff.
의존도 이런 것들이 줄어가지고 뭐 하여튼 좀 네, 여러 가지로 이제 좋은 점들이 많이 있습니다. 그래서
So,
일단
these are
일반
the advantages of
보철에서는
digitalization in making
임플란트도
general
그렇고 또
prosthesis.
하나 막상 하다 보면은 뭐가 있냐면 뭐 이게 예를 들어서 깨지거나 뭐
To take
빠졌거나
another
해서
example, when
재제작을
broken
해야
or
되는
missing
경우가
prostheses
있는데
require
그러면 그거는
remanufacturing,
환자분이 다시
the patient has
재확인을
to visit the
해가지고 새로
clinic
꽂으셔야
again
되는
to take
경우가
a new
있거든요.
model,
시간이 좀 지난 경우에
because models get
정보가
lost or
없어지고
break with
그러니까
time.
그렇지만 여기에는 이
But in
데이터를
this
백업을
case,
해놓기
the data
때문에
is already backed up, and the
환자분이
patient
다시
does not
내려가지
have to visit
않으면
again
지금
to
이런
remake it.
상황에서 뭐
When I
그걸
have to
잊어버렸다 아니면
remanufacture
뭐
them in
이런
my
하여튼
clinic
뭔가
because
재생을
they're
하고
missing or
그러면
lost, I can
데이터를
find the backed up
찾아가지고
data
기공소에서
and send it to the
복원해서 다시
laboratory to just
보내거나
reprint it.
기공소에 아니면 기공소에서 예전에 디자인한 그 크라운 파일이 있기 때문에 그걸로 그냥 재출력을 해가지고 보내주시면 환자분이 두 번
Then the
방문하지
patient
않고
doesn't
뭐
have to
다시
visit
손을 대고
twice,
이런 번거로운
and you can
과정
just
없이
seat it in the patient's
바로
mouth
세팅을
without
할 수
cumbersome
있는
processes.
그런 아주 큰 장점이 있습니다. 그래서 일단 일반 보철에서는 예전에 여러 번 하고 불편하고 이런 것들이
So now, when making a general
간단간단하게
prosthesis,
수정이
you can
가능해서
simply
할 수
edit
있고
things that required
그다음에
many repeating
그
process
본 뜨는
before.
시간보다 훨씬 일단 본 뜨는 날도 시간이 세이브가 되고 세팅할 때도 시간이 세이브가 되기 때문에
Moreover, because you can save
뭐
time making
혼자
models and placing
약속만
them,
잡아놓고
you wouldn't
그거보다
be stressed
오버타임
out
하거나
because
또
of
환차를
overtime
조정하는
or
그런
time
스트레스가
adjustment.
없어지고 항상
And because it
디자인이
always
맞을까 안
fits well,
맞을까 걱정하는
you wouldn't be
그런 게
nervous whether it
없어지고
would fit or not.
언제나 거의 잘 맞기 때문에 그 자체가 이미 그
That
치과
alone, I
의사로서
believe, can
충분히
act as a stepping
해피하게
stone
살
to
수
live a
있는
happy life as a
방식이지 않을까.
dentist.
네, 일단
So
일반
when making the
보철에서는
general
요런
prostheses,
부분이
these are the
약간 알게 되면
advantages.
큰 장점입니다. 좀 전까지는
So
그
far,
일반
I have explained how
보철을
digital
할
comes into
때
work when making
디지털이
general prostheses
들어와서
and
어떻게
advantages
쓰는지
of them.
어떠한 장점이 있는지 설명을 드렸고요. 이번에는 이제
Now I would like to tell you about guide
가이드를
using
이용한
digital
디지털
implants.
임플란트에 대해서 좀 설명을 드리려고 합니다. 일단 저는 그 일반
First of all, I opened the
GP로서
clinic as a GP and learned to place implants afterwards.
따로 이제 배우면서 시작을 했던 케이스인데요. 그래서 제가 사실은
So before using the digital method, I couldn't handle difficult cases, such as immediate implantation after extraction cases, edentulous cases, and excessive melted bone cases with residual bone height of 1 to 2 millimeters.
잔존골이 1, 2mm밖에 안 남은 이런 케이스들은 사실은 제가 못했습니다. 그래서 저보다 더
So I
잘하는
referred my
분들은
patients to
잘하거나
other
그래서
dentists who can do them.
하라고. 실제로 그렇게 했었는데 일단은
What made me happy
디지털로
as a
하고 나서
dentist
제가
after applying
치과
digital
의사로서
is that there are
경험을
few
해보니까
cases I can't handle.
거의 이제 못하는 케이스가 없어진 겁니다. 그게 어떻게
In a
보면은
way, you
그
may think
너무
that
어려운
taking on
부분을 가지고
challenging
스트레스를
cases would
늘어나게
rather
하는
give me more
경향이
stress.
있는데 이 디지털을 잘 알게 되면은
If you become familiar
그
with
어려운
digital,
케이스들이
those
쉬운
difficult cases are made
케이스가 되기
easy.
때문에
That actually
그래서
reduces
스트레스가
stress.
줄어들고 또 어쨌든 의사로서 예전에는
Anyway,
못하던
as I can
케이스들을
handle
큰
cases that I
스트레스
couldn't
없이
before,
진행해서
patients appreciate it, and I
환자들이
feel a sense of fulfillment
고마워하고
as a
그런
dentist.
얘기를 예전에는 제가 들어본
Unlike
적이
before,
없는데
since I started
이제 하고
applying
나서
digital methods,
보면은
I get
환자들한테
presents from my
선물도 받고
patients and they thank me.
고맙다는 얘기도 듣고 이런 것들이
These very
디지털
things have made my
때문에
life as a dentist happy.
삶이 좀 행복해졌다고 해야 되나? 뭐 하여튼 그렇습니다. 그래서 지금 이제
The
아까는
previous
그
general
뼈분철이
prostheses can be
스캐너만
done with an oral scanner
했었는데
alone.
물론 그냥 그
In my
임플란트를
personal
사서
opinion,
할 수도
you can of
있지만
course take an impression, but I
조금 더
recommend buying a
개인적인
CT and
생각이지만
using both the scanner and
사실은
CT.
CT를 구입하셔가지고 이제 스캐너와
With both the
CT가
scanner
두
and
가지가 다
CT, your
있다면은
implantation
훨씬
surgery
더
will be more
안정적으로
stable and
더
exciting.
재밌게 그 임플란트를 사실
In
임플란트가
fact,
치과 의사들
implantation
입장에서는
surgery
약간
is a bit
스트레스고
stressful for dentists,
거시기고 좀
and if it
그런
is
많은
difficult, it gives
경우에
you greater
어렵을
stress.
텐데 이 두
If you
가지를
get the
잘 그
CT and a
병행해서 잘
scanner and make
사용하신다면
good use of them, you will
정말
be able to live a
행복한
really happy
치과
life as a
생활을 하실 수
dentist.
있을 것 같습니다. 그래서 일단은 그 저는 지금
Fortunately,
이제
there was a CT in my
처음에
clinic,
CT는
so
원래
I
저희
bought a
병원에
scanner and
지금
started.
방에도 있었고 이제 스캐너만 사서 이제 시작을 했는데 이 제가
Unlike other
환자들한테
clinics,
설명을 할
I
때
explained to patients what
다른
it
데와
means to do
달리
everything
디지털로
digitally.
하는 것이 어떤 것인지를 설명을 합니다. 그럴 때 그 우리가
When doing so, it's
의외로
hard to view things from the
환자 입장에서
patient's
생각하지
perspective.
못하는 경우가 많이 있는데 어,
First of all,
일단
from their
이
point of view, the
디지털
biggest
임플란트
advantage of this
설정이
digital
가장 큰
guide
장점은
surgery is that it
일단
minimizes
환자분들
the
입장에서
incision,
보면은
if not none.
인시전을 웬만해서는 하지 않고 최소화한다는 겁니다. 그게
When I
사실 뭐
speak to
제
my
듣는 사람들도
colleagues,
보면
many say they
그럼
do
뭐
not
최소화하면 되지
understand
뭐
why it has
이렇게
to be
하나
done in such a
소소하게 이렇게
complicated way
얘기하는
when they can
분들도
just make
계신데
an incision.
그건 의사들의 입장인
That's
것
just the
같고
dentist's perspective.
환자분들의 반응을
The
보면
patient's response has
생각보다 그게
taught me
굉장히
what is more
중요합니다.
important.
우리가 그 마취할 때
As
생각보다
important it
큰
is to
이슈가 없고 하면
patients
되게
whether there's pain
좋아하거든요.
when giving anesthesia,
그래서 일단
minimizing
환자분들
incision is
입장에서는
also
이
important.
인시전을 최소화한다는 거 그게 가장 큰 장점인 것 같고 의사 입장에서 보면은 그 사실은 이제
From
어떻게
dentist's
보면은
point of
그
view,
인시전을
you may
하고
think that it is more
뼈를 딱
promising
볼
to perform
보면서
surgery
수술을 하는
while
게 더
looking at the
확실하다고
bone after
생각을
making an
할 수
incision.
있지만
That's
이제
fine in
그거를
easy cases,
쉬운
but it's
케이스에서는
very difficult
괜찮지만
in
이제
cases such
그게
as
같이
immediate
이제 어린아이
implantation
폐기로
after
몇 년 동안을
extraction
하는
that accompany
케이스일 때
severe bleeding
이
and
사업과는
inflammation.
건들지
That's because
말지
it is
하고
very
되게
uncertain and vague
설명해드리기가
whether
이게
to touch the mandibular
부담스러웠는데
canal,
그리고 이
where
위치가
and how
괜찮은
much the
곳인지
maxillary sinus
내가
is to
지금
be
수술하는
drilled,
방향이
whether this
괜찮은지
location is
이런 것들이
okay,
항상
and whether the
막연하다가
direction of
이제 이
drilling is
디지털로
correct.
하게 되면은
These things
모든
have always been
소견을
vague,
정확하게
but once you
그
use
임플란트
digital
위치를
equipments, you can
제가 다 볼 수가
precisely see
있고
all of the
처음에는
implant
잘 안
locations
보이는데
in the software
사용하다
in
보면
advance. You
이제
can't see it
갈피가
clearly at
뼈에
first,
진동거리
but
얼마나
as you
남고
continue to use
내가
it,
위치
you will see the
이동했을
height
경우에
of residual
임플란트가
bone
어디가
after
정확하게
extraction,
진동걸 어디
how
부위에
deep the
들어가고
implant should
어느
be
부위에
located
접속이
at
되고
which area
있는지
of the residual
그래서
bone,
뼈 이식을
about how much the
어디에
implant should
얼마큼
be
해야
revealed,
되는지를
and where and how
처음에는
much of the
점점
bone
점점
graft is
감이
needed.
없다가 시간이
You don't have
지나면서
any idea
내
at first,
머릿속에 이게
but you will be able
심리해져요.
to run
그래서
simulations in your head over
나중에는
time.
금방금방
Later
그거를
on,
이제
you will be able to
머릿속에
do it
보지
all
않으면
quickly
다
without looking at it.
잊어버리고요. 그래서 오히려 이제 한국에서도 그
In Korea,
학생들
when I
대상으로
give detailed
디지털
lectures to
기기를 하거나
dentists or talk to my
시술하는데 이렇게
friends,
얘기를 하면
they wonder how it
되게
is possible to
놀라시더라고요.
handle
이거
immediate
다칠 수
implantation
없는 거예요?
cases without
이런 얘기
actually
진짜
looking
많이
at the bone.
하시거든요. 그런데 이거
But if
디지털을
you try
사용을 해보면은
digitalization, you will
오히려
realize that
폐지기 쉽지가
digitalization is
않은
required for immediate
임플란트를 해야 된다는
implantation
걸 아시게
cases.
될 거예요. 그래서 가장 큰
So,
장점은
the
뭐냐면
biggest
내가
advantage is that
원하는
I can
곳에
place the implant
정확하게
exactly where I want
임플란트를
it to
놓을 수
be,
있다. 이게 가장 큰 장점이고 그것
and
때문에
it reduces
스트레스를 덜 받는
stress.
겁니다. 수술이 예상이 가능하고
Because the surgery is
그리고
predictable,
어차피 보지
you
않기
wouldn't have to
때문에
open the flap that
신경을
much.
많이 제칠 필요가 없고 뼈 이식을
Since you
하면
only need a
뼈 이식을
minimal
하고 나면
incision
그냥
for a bone
인시를
grafting,
열면 되기
very few post-surgical side effects are found. Therefore, the patient's post-surgical satisfaction is much higher. And as I explained before, you will be able to handle more and more cases. Anyway, happiness as a dentist means an increase in my ability. Being able to handle cases using digital that were too difficult to handle. Being able to handle cases I couldn't handle before, with much less stress than before, instead of getting stress while doing it. These, I believe, lead to acknowledgement from patients and a sense of fulfillment within myself. So in some cases, dentists that I used to refer my patients to send their patients to my clinic these days. Usually, with residual bone that has height of only 2 to 3 millimeters, whether it's maxillary or mandibular when grafting the bone and waiting for 6 months for implantation, everything usually takes about 10 months to 1 year. As you well know, when you successfully perform immediate implantation case, it saves a lot of time because implant is placed immediately after extraction. I'm getting a lot of help from Dio, and the osseointegration of the UV implant developed by Dio is much faster than I expected. Of my immediate implantation cases, for half of the cases, the prosthesis is seated 2 months later, and for the other half, 3 months later. It's that fast. That doesn't mean it's problematic. It's that stable. As the implants are placed exactly where I want them to be placed during surgery without looking at it, and the incision is minimized, patients experience less post-surgical pain. It is good for us too, because patients experience less pain after surgery. Let me tell you another advantage. Before digitalization, I had never handled edentulous cases because it was beyond my ability. Of course, I handle many such cases now. As other speakers will explain later, the first principle of this software is to first position the teeth with the top-down process. Because the implant is positioned afterward, the final prosthesis is quite complete. You may have experienced some cases where it becomes very difficult to make final prosthesis after implant is placed by only looking at the bone without planning. But if everything is done digitally, this also is a big advantage, in my opinion. Whether it's a single or a bridge, you can position the teeth first and then locate a position for the implant accordingly. This is a top-down process. So far, I have spoken about the advantages on the day of surgery. In the end, in addition to the satisfaction of the prostheses, you'll realize that the process is very simple and you rarely feel anxious of making a big mistake. When it comes to implants, this is the biggest advantage. The second advantage is, for example, if you need a second surgery, such as in an immediate implantation after extraction case, and you don't do it digitally, you usually have to make an incision again to find the buried implant, connect the healing, and stitch it back. After that, you may take an impression of the fixture itself, or after connecting the abutment. For me, I experience less stress during the surgery itself, but the second surgery or prosthesis placement is very simple as well. For the second surgery, there is a guide that you have used on the first surgery. You can place this guide on the residual bone and place an impression in the hole. Later, when you seat the guide during the second surgery, the hole location is the location of the implant, So you will find the exact location of the implant if you drill the tissue alone with only a tissue punch.
위치를 찾을 수가 있습니다. 그래서 뭐 세컨 서저리라고
The second
하기가
surgery is too simple to call it a surgery.
굉장히 간단하고
And
환자분들
since it doesn't
입장에서
involve
손으로
disinfection
주물러서
and stitching the next day,
일이 없기 때문에
patients suffer less.
그래서 저는
That's why I
세컨
think the guide plays a
서저리가
very important
케이스를
role in
돌리는데
reducing
엄청난
stress in second
가이드가 역할을
surgeries.
한다고 생각합니다. 그리고 나서 이제 그
And if you look
그
at the
키트에
DO
보면
kit, you will
그
see a
본
drill called a bone profile drill.
프로파일이라는 드릴이 있는데 그 드릴로
This
이
removes the bone around the
필터의
fixture.
이제 주위에 있는 뼈를 싹 제거를 하고요. 보통은 아날로그
As mentioned
방식에서는
earlier,
아까 설명드린
such method
것처럼
is
이렇게
used in an
사용하고요.
analog method,
또
but we use
이쪽에는
what we
이제
call
디지털
scan
메시지
body in a
스캔
digital
바디라는
method.
있습니다. 그래서 그 스캔 바디를 연결하고 뭐 다른 강의에서 들으시겠지만
Connect the
스캔
scan
바디를
body like
연결하고
this.
그걸 그대로 이제 여기 또 이렇게 네 그럼 잠깐 요거
I will show you
다른
pictures of other
스캔 바디
scan
사진 좀
bodies.
보여드릴게요. 제가 아까 그 2차 수술에 대해서
I have covered the secondary surgery earlier, so let's
케이스를
take a
하나
look at a
볼까요?
case.
지금 이제 여기 그 파노라마 사진에
Here,
보면
in this panorama picture,
20대
I have made a bridge connecting number 23, number 26, and number 27.
7번
But the
브릿지
case requires extraction of teeth due to shaking caused by severe bone resorption.
발치를 해야 되는 케이스죠. 특히
It's
이제
more
브릿지
accurate on the
보면은
CT of the posterior teeth.
보면 더
You
정확하겠지만
can see that
이게
bone resorption has progressed to above the apex.
이런
If a
케이스를
patient with such a
예상해서
case came to see me before, I would have referred this patient to a bigger hospital because it is beyond my ability.
그런 케이스가 되겠죠. 얼마 전에
This is a patient who had a prosthesis set up today.
그래서 이제 이런 케이스를
This case falls under the category of cases I couldn't handle before, but using a digital implant for guide surgery has enabled even an ordinary person like me to handle this case, which was impossible to handle before.
아예 못하던 케이스를 할 수 있고 엄청난 스트레스를
It
받을
doesn't even give me a lot of
이
stress.
정도면 한번
It just
해볼만
gives me a
하니까
challenge worth trying.
이겁니다. 그것만
I guess that alone adds to the reason for being happy.
그래서 이제 요 아까
As I mentioned
설명드린
before, once you see each and every bone on the software, you will need to see where to place it and what to do with it.
어디에 위치를 시키고 어떻게 할지 저는
Personally,
어떻게 하냐면
I avoid implantation in these areas where there are barely any bone left.
그래서 지금 어떻게 했냐면
So what I did was this.
요 어려운 자리는
I avoided difficult areas without bone, extracted number 2, and implanted 3 here where there is bone.
세 개 뒤에 이제 좀 뼈가 좀 있는 곳에 해가지고 그러니까 이런 것들을 그
Doing these myself, although I still am a computer illiterate, I am now able to skillfully use this software.
소프트웨어는 이제 잘 사용하게 된 거죠. 생각보다 이런 식으로
As it is designed in a way to help you do it intuitively,
그
any dentist should be able to use it skillfully with some practice.
사용하면은 쉽게 잘 쓸 수 있을 거라 생각되는데 어쨌든 도저히 뭐 이쪽에
This patient was an elderly person, but I placed implants using the remaining bones here with bone graft.
해야 되는 케이스를 이제 여기 남아 있는 뼈들을 이용해서 이제 임플란트를 한 거죠.
I have now become able to handle these cases.
진료가 된 겁니다. 그리고 나서 이제 아까 제가 세컨 서저리
Now I will explain the second surgery.
이제 뭐 여기
Since I did the immediate implantation here, bone has of course been grafted as well.
다 아물어서 한 3개월이 지나가지고 이제 아까 설명드린
After 3 months of healing, you can place the guide.
가이드를 끼면 지금 이제 여기가
This is the scan body connected stage, but in this stage there would have been no scan body.
상태에서는 스캔 바디가 없었겠죠.
If you place the guide and punch the tissue, you can easily and accurately find the location of the implant to seat the scan bodies. As those who have searched for implants of this depth with incision know, this is not simple.
아주 쉽게 찾아서
But for me,
바로
it was found very easily, and the scan body was connected on the same day.
그리고 그 다음에 이제 임플란트 포철은 아까 설명드린
After that, the implant prosthesis would look like the general prosthesis mentioned earlier.
인식되는 저
and if you use the digitally recognized scan body, accurate bite acquisition is available.
이것만 정확하게 바이트 체득해가지고 네, 상당히 어려운 보철이죠. 이 보철 자체도
This
뭐 이렇게
prosthesis
뚫기만
itself is a
어려서
very
하든
difficult to make,
아니면은
whether it is made on a fixture
어른들한테
level
병원에서
or it is
구입을 해서
prepped in the
하든
mouth after connecting the
굉장히
abutment.
어려운 케이스인데
In this case, just
이렇게
connect the
그냥
scan
똑같이만
body and use the
연결하고
scanner to
스캔으로
scan and
해서
send the file to design the crown.
템플릿을 보내면 이제 다음에 다
In
아시다시피
my case, I finished
이거는
the
이제 보통
prostheses with
커스텀
100%
어바ut먼트
customized
지금
abutment
저희가
and
보철로
zirconia.
마무리합니다.
I don't
저희가
offer other
임플란트는
options for
모델만
implantation in my
바꾸면
clinic.
똑같이 합니다. 무조건
I do
커스텀
everything the same way.
그다음에
Always use
네,
customized abutment and
그래서
zirconia.
이렇게 모델
So I
있습니다.
got this
모델 없이
customized bridge
다
without a
설명을
model
드릴
like
시간이
this.
있는데 제가 오늘 이거
It took me
세팅하는데
about 30
30분
minutes
안
to set it
걸렸어요.
up today.
그러니까 30분 정도 걸린 것 같네요. 이렇게 이
This
어려운
difficult
케이스를
case took 3 months
3개월에
to
다
finish.
끝났거든요. 그러니까 이 정도면은 뭐
That is, with this, it is safe to say that you don't have to worry about the quality of the product or stress of the dentist compared to before.
것들이 예전에 비하면 거의 없다고 봐도 됩니다. 그리고
For
지금
reference,
설문적으로 또
this patient finished this part today, but this part was done in my clinic as well.
여기는 어땠었냐면 수진 사진을
If you
보면
see the pre-surgical
이렇게
pictures,
다
this patient needed to have all these extracted.
상황이었죠. 마찬가지로
I likewise
다
planned immediate implantation.
사실 제일 어려운 게
In
보통은
fact, the most difficult and stressful implant cases are the immediate implant placement cases where the bone width of the anterior teeth is narrow,
임플란트 수술할
and the
때
edentulous
스트레스
cases.
받는 케이스인데 마침 여기도 있길래 같이 설명드리면 이 전치부도 굉장히 골폭이
The bone
좁은데
width of the anterior teeth was very narrow, but I did an immediate placement after extraction.
네, 다 발치 즉시로 이렇게 연결해가지고 이것도 이제
This was
최대한
done with barely any bone graft,
뼈
so I
있는 거의
attached an
없이
H-scan body here.
스캔 바디 달았는데 다 발치 직수로
When there
해서
is very little bone graft, especially for mandible and immediate placement case, I always use Dio's UV implants.
100% 사용하는데 제가 보통
Usually,
한
I
달을
perform an ISQ
하고
test for the mandible after a month.
테스트를 하거든요. 근데 테스트를 해보면
When I perform tests with test devices I got from Dio, almost 90% of the test results in good ISQ after a month.
어느 정도 나오더라고요. 그래서
And this patient asked to expedite the process for the anterior teeth, so the anterior part was almost finished after only a month.
아이고 죄송합니다.
I took this CT afterwards, but this is what it looked like after it was finished in a month. And because this case was an immediate implantation case, it took 3 months to finish. I wouldn't have even imagined this kind of results with my previous skills. This case was also finished today, and I took a CT to show it to you. Now I can handle almost all cases that I could not handle before, all thanks to digital guide implant placement, and you can do it too.
이렇게 여러분들도 누구나 할 수 있다는 겁니다. 뭐 아무래도 우리가
You know,
병원을
to run our
하면서
clinics,
이제
we
한
need
가지
patients to come to our clinic to make a profit.
또 수익도 어느 정도 창출이 돼야 되니까. 예, 왜냐면 예전에는 돌려보낸 케이스
This is a case that I would have sent back before, but now I do this case without any hesitation.
이러지 않으면서 이 케이스를 이렇게 하고
This was done at another clinic, so this patient has previous experience of having an implant placed, and the patient feels completely different.
환자분도 느끼시기가 완전히 다른 거죠. 그래서 일단 임플란트
So, of course, the biggest advantage of digitalized implant surgery is being able to do this.
큰 장점이지만 아까 보여드린 이렇게 간단한 세컨 서저리
And also with the simple second surgery I sent you earlier, the entire process, from scanning to the final prosthesis, is significantly simple and accurate compared to before.
다 예전에 비하면 너무 간단하고 정확하다는 거. 그래서
So you don't have to worry whether the prosthesis will fit or not for this patient. I don't worry about that at all these days. That's because all those thoughts have already passed, and I feel comfortable using this system. So, regarding implants, both initial and second surgery is very simple. Usually, when you make an incision in the second surgery, not only is it difficult to find the hole, but you also have to disinfect it, stitch it, and unstitch it again when it is healed after a week, and then take an impression. Since bleeding hardly occurs when the scan body is connected by just punching the hole on the day of the second surgery, I scan the patient on that day if I get a certain value in the ISQ test. Then it's simple, and the number of patient visits is greatly reduced. From the patient's point of view, especially those who have experienced it for 6 months to a year in the past, definitely feel the difference, and they bring other patients as well. I think it's also nice that many come to see me after hearing those stories and already know about the process to some extent. This is because going on with procedures with some trust built after hearing some stories is different from going on with procedures without such trust. I have countless cases like this since digitalizing the clinic. After digitalization, the number of implant placed increased greatly, since I'm treating patients that I would have sent back. Now, I will show you an Edentulous case. As with the immediate implant placement case earlier, I wouldn't have been able to handle this patient in the past. I would have thought, why did this patient come to see me? I also would have thought, you've come to the wrong place. But after I started using digital equipments, I am making YouTube videos as well. I made YouTube videos to share digital implants with many people. So this patient came to see me after looking up a YouTube video. I was able to handle this case. This was a case that I could never do. All the while performing immediate implant placement after extraction. I will show you only the final picture. Here. I don't have pictures of the prosthesis or of inside the mouth now. As explained earlier, if you place the prosthesis with the guide, you cannot misplace the implants in the completely wrong locations because the locations of implants have been marked with the teeth positioned in advance. I think that's a big merit in the Edentulous case such as this one, in addition to many other merits. I can't say that I did a perfect job in the Edentulous case, but the patient is using it well. It was a case that I can't even lay my hands on. I don't have a picture of a prosthesis, but I was told that this patient knows 4 dentists personally, and that the patient consulted with all of them and came to see me. So the fact that I can handle this case, this is rewarding personally. I keep harping on this, but if I didn't become digitalized, would I have been able to handle this case in my life as a dentist? A case like this, that's how I was able to take care of an edentulous case to that level. By that level, I mean that as a dentist with 15 years of experience, despite being a GP without completing courses on specialized implants or periodontology, I have been able to achieve that level with the help of digitalization. I am saying this has been possible. I'll show you another one. This one is not common in Korea, but there are many cases overseas, and I have done one case like this. Both the maxilla and mandible were edentulous.
저는 이제
but I added one to all on 4.
하나를 더 했죠. 뭐 하나 더 있으면 좋으니까
It's an asymmetric concept, but it's nice to have another one.
하나 정도 더 해서 어쨌든 중요한 거는 뭐냐면 이제 제가 이제
Anyway, the important thing is that I, an ordinary dentist, was able to do this.
하게 됐다는 게 이제 중요한 거죠. 그래서 이제 여기 보시면 제가 유튜브에도 뭐 얘기했었지만 사실
So,
예전에
if you
그
see here,
바이오
I mentioned this on YouTube,
그런 회사에서
but I personally felt very proud that I actually did the case I admired at Nobel Biocare seminar that I attended 10 years ago.
했던 거를 제가 한 거라서 개인적으로 굉장히 좀 뿌듯하더라고요.
I designed it all by
그냥
myself.
혼자 다 디자인한 겁니다.
I designed it on computer software and did the actual surgery. This goes along the lining of the maxillary sinus. It looks like this on the X-ray, but it is actually almost 30 degrees or more. I saw all these in advance, and I did the same for the mandible as well. As far as I recall, I probably did all this on the same day. As it's all on 4 on the maxilla as well, I placed a minimum number of implants considering cost or other issues. As you can see here, much of the bone has melted. Digital implant is advantageous in that you can avoid these areas and place them in areas with healthy bones. In the case of Edentulous cases, when I map out the strategies, I arrange teeth, look at the bone locations, and if there are 6, I have to see where and how to arrange them. It would take me 4 to 5 hours to operate on bone like this. Because even if you familiarized yourself with the software, you constantly have to think about where to place it and decide on the location. I would have questioned, do I really have to do this before? With the COVID-19 and nothing to do after work, it's become very fun to stay and do these surgeries. I am not the type of person who enjoys these things, and I am not an academic person, but this was so fun. So after work hours, it's a happy dental life for me to stay and design, whether it's single or multiple. I will show you a CT. If you dig deeper into Edentulous cases, you have a lot to study, but that doesn't mean you can't handle them. Because I did it too. If I did it, anyone can do it. In this Edentulous case, there's an auxiliary hole here to which you can fix. Because you can't hold the guide in place as it is Edentulous. First, fix the guide with 3 small screws as small as an implant, and proceed. If I'm correct, this surgery was done on both the maxilla and mandible on the same day, because I didn't make any incision. In the all-on-4 case, it was very fun looking at the CT also. Because you can be confident of the direction and location of the implant in 3 dimensions, and how to position the guide. Because it is not uncertain and vague, and it doesn't make you nervous. In my opinion, digitalization is good for our mental health. This is the case that I finished with a hybrid denture containing a metal frame and a fixture. Now that it's out there, is everything we do now going to be boring? Absolutely not. It's fun every time. Every time, I access the software to design, and the final product is very satisfactory. I showed you the process earlier, but both the second surgery and prosthesis are fun because they are very simple to do and they fit so well. You learn the ropes as you go on, and also face new challenges, but it's fun to overcome them one by one. I am neither too old nor young, but I find working in the clinic the most exciting these days. Of the 20 years of my career, the last 2 to 3 years have been the most exciting. So I hope those of you living abroad can bring something home after listening to me. I spoke to you not to give a lecture, but to tell you that an average, ordinary dentist like myself can handle unimaginable cases. As you embrace digitalization of your clinic and strive to pursue this direction, and that you can do so without stress. Again, the most important part is to buy a CT and an oral scanner. Then, because you have to keep learning new things, guide, new software, etc., it will cost you money and energy. But the key is your will to become digitalized. It's been exactly 3 years for me. It's been 3 years since I started, and I keep emphasizing that anyone can do it. But the will is crucial. Because rather than thinking whether to give it a try for a little while, or whether to try it for once, it is only possible when your entire goal is set on making your clinic where everything is done digitally and steps are taken one at a time. I've seen so many who return to the old-fashioned way after feeling exhausted from using both analog and digital. Make it a goal to do everything in the clinic digitally. I've made it this far doing so. Otherwise, I would have gone back to the old way too. If you tell me to take an impression, I can't. Now I can't. And I don't want to. I only use custom and zirconia, but in Korea, some cases are covered by insurance, so I have to use pre-made abutment and PFM. Turn back the clock to 1 year before, and I was telling students that we should take an impression. I told them we have to take an impression in that case, but it's available to do so digitally these days. So we see improvement day by day. The remaining impression material is a light body, and a detailed impression is gone. Impression material is necessary for dentures because they are not 100% digitalized. Only a small amount of impression materials are left to make dentures, and we no longer use impression materials in general. As you continue, you can introduce a 3D printer as well. In my case too, I bought a 3D printer to print almost everything in the clinic. I print guides at the clinic as well. It offers many advantages for those who do orthodontic treatments as well. I too sometimes use digital orthodontics by Dio. For example, taking an impression for orthodontics involves impression with alginate. But now, because we use the scanner and print with the 3D printer at the clinic to send it, clinics no longer use alginate and plaster. They are not fully gone, because they are required for dentures. But I will definitely make some tries when dentures can be made digitally, because my ultimate goal is to digitalize my clinic 100%. Like me, take one step at a time toward the goal. Ordinary dentists like me will be able to handle more difficult cases with fun and excitement. I might have rambled, but anyway, I spoke to you to motivate you to taste the digital world. I will wrap it up for now. Thank you.